All right, so we're going to get into something that's been much of a debate across this country.
Is healthcare a right? Is it a right as a human being to get healthcare from your government? No, your neighbors. Can they pay for your healthcare? Can it be taxpayer funded? What is the Affordable Care Act, Dan?
All right, so
I just love talking like that.
I know, I love it too. Did you saw my face? All right, so we're going to go over a little bit about Affordable Care Act or Obamacare. They are the same thing.
Yes.
I've seen a lot of, I'll admit, humorous tweets where people didn't know that they were the same.
Dang millennials, bro.
Yeah, I know. They suck. So we're just going to do a little rundown because I found it quite confusing, to be honest.
I'm sure a lot of people have.
Yeah. So they definitely could have worked on their user interface, you know what I mean, kind of deal. So basically, Obamacare expanded on certain socialist aspects of our healthcare that already existed, such as Medicaid. It expanded Medicaid in the majority of states, basically, which means that before, if you made a certain amount that didn't qualify for Medicaid, when they expanded it, you could have been caught in that net, and then you could be covered under Medicaid.
Okay.
It also put certain protections onto Medicare, which is basically the socialist side of old people with coverage. Anyone over 65 qualifies for Medicare. We pay into that our entire lives through working. It comes out of our paycheck, and then we reap the benefits when we turn 65. Hopefully it's still there when we turn 65, Nick.
Or hopefully it's not.
But yeah, maybe we'll have universal health care. So what Obamacare did is it kind of bridged the gap between Medicaid and Medicare. So in the middle, beforehand, you just got private insurance. You called them up, went on the internet, you went to their, store, if you will, and you said, hey, I'd like insurance. They said, all right, are you messed up in some way? If so, we'll charge you more or not give you insurance. Otherwise, here's your monthly payment. If you get hurt, we'll cover it. You know what I mean?
Can you tax people for not having enough money to afford something?
What do you mean?
Isn't that... It's a mandate. You need to have this insurance. You need to have health insurance. And if you don't, you get a fine.
You get a fine, yep.
Isn't that sort of like not having enough money in your bank account, so they fine you even more money?
So they draft you, yeah.
That makes no sense, but a lot of families are paying that fine just because that's more affordable than actually
I heard that.
they could get.
So the reason the fine was included was a big part of what Obamacare strove to do. Like I said, it was trying to bridge that gap. So instead of just private insurers, it basically subsidized what those private insurers offered. So it created a marketplace where you can go online and compare and contrast different policies, and then you can see what subsidies you qualify for, which is basically government cost assistance. So it used the infrastructure of private insurance that already exists in this country and kind of put certain federal regulations on top of those private insurers.
Therefore, raising deductibles and premiums.
Yes. So I do want to say certain things about that, so we'll definitely get into that, I think. Another thing it did was it extended kids' plans till they're 26 under their parents. That was kind of bipartisan. A lot of people like that. It covers pre-existing conditions now. It guarantees 10 essential benefits for every plan, and we'll throw up a graphic for that so we don't have to list them all down. Basically what the federal government thinks is necessary for each person, and that can get dangerous too because a lot of people have different needs, and to put a blanket term on all those needs can be dangerous.
Right.
And back to your fines, the reason the individual mandate was kind of included in Obamacare was to tip the scales towards people who were sicker or had pre-existing conditions. So if a healthy young person needed to buy insurance or pay a fine, they're contributing to the system one way or another. And that extra money basically goes to help people who would have had to pay more based on their sickness or pre-existing condition.
Right. So I think this gets to... obviously, this is stemming from the Bernie Sanders-Ted Cruz debate.
Absolutely.
Earlier in the week. It's obviously a hot-button issue. But I think what Cruz did show is that in countries that do have this universal healthcare, or at least socialized aspect, is all it is prioritization in a different light. Sanders argued that right now we have unofficial rationing due to wealth and class, but, and like you just said, with young people who are healthy paying into the system one way or another, over in those other countries, they have prioritization for those who are healthy versus unhealthy. I think
Right.
what he said was like old people won't get like those services as quickly because they're already like really old or something
Yeah.
like that. It's just allowing the government now to choose who gets prioritization because, as Sanders repeatedly said, Obamacare isn't the end goal. The end goal is universal health care, and that diminishes quite a bit of choice and freedom.
I would agree with that. And yeah, Obamacare's main goal was basically a path towards universal health care. Whether it did it right or wrong, there was definitely some things that failed. A lot of its taxes that it tried to put into place to like subsidize the private market kind of didn't work as expected. So like you said, a lot of people had their premiums rise. So I have a number on that, about I think 2 million people. So there's a lot of people who had their premiums rise. I actually have some experience in this. I was wondering if it'd be okay if I talked about that.
Please.
So we all know that 20 million people got insurance under Obamacare that didn't, and that sounds like a really great thing. People who had pre-existing conditions that were getting very sick and couldn't get help got their help. But for middle-class families who got insurance based on their employer, like my dad, their premiums went up quite a lot, and they did not qualify for any subsidies on the marketplace. So unfortunately, my parents now bear the full weight of those premium increases here in New Jersey.
Well, I mean, this exact same thing has been happening when it comes to college and whatnot as well. Is the funding goes to the most poor, and then the most rich don't have to worry, obviously, because
Right.
they're already rich. And then a few super smart cookies get in through like scholarships or
Yep.
whatever. But through and through, it's the middle class that has to pay the ever rising cost because they're not seen as poor enough to afford the subsidies, but they definitely can't afford it themselves. It seems like it's the same type of thing here.
Nick, it's literally called the family affordability glitch. There's a page on it on the Obamacare like facts, wiki kind of thing. They're well aware it exists, and it affects a lot of people. But there's a PolitiFact article on it that said that 81% of the people that were affected by premium increases, like how Cruz was talking about it quite a lot in the debate, 81% of them did get some sort of cost assistance. Now, whether or not that meant they paid less than they used to is remained to be seen. That wasn't reported on. It just said that they got cost assistance.
Mm-hmm.
So that leaves 19% of the insured population without cost assistance, just like my parents. And that's about 0.7% of the population. Now, sure, it's small, but it's not nothing.
Right.
And those are human lives. It can't be discredited as like an error. You know what I mean?
Yeah, I mean, I think Cruz mentioned, I forget if it might have been in Illinois, he was talking about a good 700 people were on like a wait list
Yeah.
for whatever, and unfortunately passed away while on this wait list, whereas in his ideal version of the world, there'd be way cheaper insurance due to tremendous competition, and they'd be in complete control over their own. They wouldn't have to wait on anybody but themselves, essentially.
A lot of arguments, or people would argue saying that that's like a very specific case, but
I mean, there's no doubt he cherry-picked that.
sure, but can it be shooed away? I mean, it's a human life that passed away.
It was also real, yes.
You know what I mean? Like that was somebody's family now doesn't have them.
Well,
you
yeah,
know?
he was connecting that to other countries in Europe that 100% had. He listed a bunch of different occasions where people were waiting for months for
now
something they could get here in a week.
Maybe it's small, but it can't be overlooked. That's kind of what we're getting at here.
Mm-hmm. Well, because I think the difference is, I'm trying to reach for like a grander argument here, and it's probably not going to be too sound, but something like this, it is small, but it's like guaranteed under any sort of socialized healthcare. Like it's inevitable.
Like it will happen. You're saying
it will happen. Whereas privatized insurance, Sanders would argue, you're leaving poor people out in the cold. But Ted Cruz would argue the prices are going to go down due to more competition. And it's not inevitable that these people will suffer because they can get themselves at least to the point where they can afford the cheapest insurance there is.
Right.
Whereas other people on the government guaranteed healthcare, they already have the insurance, but they still can't do anything because they're just forced to wait due to rationing.
Right. It's a difficult
I probably
discussion.
Just screwed up so many different variables.
No, I mean the argument is sound. I mean it's exactly
If
what
what I'm
Cruz and
saying
Sanders
if what
was
I'm
talking
saying
about.
is even true though, I don't know I'm sure somebody could come in and be like, dude, that is not how it works.
It's interesting. Sanders in the debate, he pulled out a number of I said tens of thousands of people die because they were uninsured. Now he was referencing a report that tracked mortality based on the uninsured rate, and much like a lot of different studies, basically the last sentence of the report is correlation does not equal causation.
Right.
And that's very important to remember.
That's like 101.
Yeah, you're right. So, yes, was there a correlation between being uninsured and dying? I mean, of course there was, you know? There's a lot of factors that play in. The fact that you can't afford to go to the doctor, et cetera, et cetera. But it doesn't exactly mean that not being insured causes death, you know? That's kind of what Sanders was getting at, and you have to take it with a grain of salt.
Right. And I also just want to say this. This is like a really random critique of that whole debate. I wish both of them, and pretty much any debate, stopped using the term, quote, the American people, because it's obviously a split decision. Otherwise, there wouldn't be a debate on live television in the first place. And it gets annoying that both of them say the American people have spoken.
Yeah.
Well, which one spoke? So that was something, and for some reason, this just gets to me. I don't understand for the life of me why Bernie is like, in this debate, he actually didn't do it that much. But he tends to just grasp at, look at how rich these people are. And to me, that has nothing to do with how poor people are. And I don't even think economically it does.
Yeah, I mean, obviously, he was also for a more stratified tax bracket.
Yeah, he likes creating the juxtaposition. Yeah. Look how poor these people are, while some people have it so good.
Yeah.
Okay, but those people who had it so good weren't given that. They didn't steal it.
Right.
And
the argument that goes along with that is if you have the means to purchase better insurance because because you worked hard and got rich, then why should you not be able to? You know what I mean?
Mm-hmm. And we'll get back to this. I'm actually going to look it up right now. But Sanders said something that scared me. He said there were 43 million people living in poverty in America.
Okay.
That's literally 1/7 of the population.
Holy crap.
That cannot be right. And nobody stopped him on it. Continue talking.
Yeah,
but...
no, okay, I'll continue talking while you look that up. Well, there is a poverty line, so definitely look into that. Where if you're below it, you're considered living in poverty. You know what I mean?
Right.
It's like a household income number. I'm going to keep talking about this debate while you look that up.
Please.
I'm just going to go through a couple things that Sanders and Cruz said based on like a PolitiFact thing, like how they rated. So Sanders said that the U.S. is the only developed country not to guarantee universal health care. It's like half true because some countries offer it, but they don't necessarily guarantee it, so it's kind of touchy. But if you look at like UK and Canada, it is true. He also states that per capita, we pay 3 times more than the UK for healthcare, which is true. We'll throw that graphic up. I mean, they have the numbers. That's definitely true. Whether it's because they have universal healthcare or not, we can't definitively say, but it is true. Cruz said 6 million people had policies canceled due to ACA, and that was mostly false. When it all was said and done, about 1 million people.
So where is he getting those extra 5 million?
I don't know, man. I think, well, it said that about 4 million people got like a notice saying it may get canceled, and then it like switched their policy. But when it was all said and done, 1 million of those people ended up without insurance, basically. So that was kind of it was rated mostly false. He did pull up this map, though, that I thought was really interesting. We'll definitely show you guys that.
70% of nation's counties lack choice and competition on Affordable Care Act exchanges.
Right. So what you were saying before is that the conservative side of the argument wants competition in the private insurance sector.
Yeah, and you made some good arguments about making, insurance portable. You can get insurance in any state, and then you can carry it with you from state to state and from employer to employer.
Right.
So that seems something that I think anybody could agree with.
Yeah.
Because if you get sick while you have one job and you're covered because you just got sick and then leave that job, need to get new insurance, but now you already have this condition.
Right, then you're screwed. Right. So this map basically shows that a lot of counties only have 1 or 2 choices in insurance providers. Now, if this was universal health care, the map would be one color. But in this hybrid private insurance socialist kind of thing that Obamacare tried to do, it's kind of hurting the choice, which is what the conservatives think will bring cheaper prices.
Right. I mean, ideally, each person would have a sort of insurance that covers exactly what they need. Like, aren't there mandates in Obamacare where a regular person like me, for some reason, would have like maternity care in my policy just because that's what it is?
Yeah, so like I mean that's like a good argument against universal healthcare is that it's a blanket thing. So what you're paying into is you're paying into a lot of things you probably don't need.
Mm-hmm.
But that's why it's called a socialist kind of stance because you're paying a set tax on the care for everyone.
Right, and I actually thought Cruz made a good point about saying like if the government mandated everybody needs to drive a Lamborghini. He's obviously not like Sanders wrote it off. He's like, healthcare is not a car. Like, yeah, obviously. But the point is, when you want a blanket thing that's all encompassing, and then you're mandating it. When you're making it an all or nothing endeavor, a lot of people are just going to have nothing instead of the something that they could have had given private competition.
So he's making the analogy that nobody needs a Lamborghini.
Not even like nobody needs is if nobody can afford to do it.
Right, I hear what you're saying.
If you're mandating it and then it's taxpayer and you have to pay whatever much just to get it, you just won't have a car now.
Now, for these people who the premiums got increased, like Paul Ryan was saying a lot of percentages, basically. He was quoting a lot of different premium increases. Like Arizona's the highest one, 116%. That's nuts. That's over double. And then there's a lot of other states, 25% increase across 39 states, like on average. And for people like my parents, they didn't get any subsidies, so they have the full weight of that. They have the burden of that. But do you think that a universal healthcare system? Do you think the tax that would be used to fund that would be less than these premium increases? Even I understand your argument where you're saying that I don't want to pay for maternity care because I'm a man.
Mm-hmm.
But what about if this tax was actually less than these premiums that are skyrocketing because of the private insurance companies? I mean, the private insurance companies are raising their prices because they're now covering people with pre-existing conditions, and they're not getting any money on that.
Yeah.
So they don't have a choice because they're a business. I don't know the number on that.
Yeah, they really don't have a choice.
Yeah.
I mean, that's the whole point is that the government is causing those rises in the first place.
Right.
Why would you want it to exert even more control?
Yeah.
I think that was Ted's big point.
Yeah.
I mean, is healthcare right? That was like the main question, kind of underneath all this in the first place. Do you have a right to my tax dollars going to your healthcare?
So
and vice versa.
A good analogy to that is education is a right. It's in the human rights. It's considered human rights. Education.
Right. I mean, life, liberty, pursuit of happiness.
Right.
You don't really have a full life unless you're educated. And whatnot.
Do you have a full life if you die?
No, no, absolutely not. But there'd also be the conservative argument against, federal schooling in the first place. I mean, it's taxpayer funded, but a lot of people send their kids to private schools, and I'm sure a bunch would agree that the government should get out of it in the first place.
Yeah, I guess. I mean, like in the UK, you still have the option to purchase supplemental private insurance, but you still are being taxed on, like you said, a blanket universal health system. You know what I mean?
Yeah, I mean, we were talking about this before, and I think education is like the best argument to make, just because it's easy to say you have no right to somebody else's expertise and services. Because when you say you have a right to it, you're, to quote Ben Shapiro, you're enslaving that person. Because you're saying you literally have the right, they must serve you now.
Like they don't have a choice.
They don't have a choice.
Yeah.
And I don't think anybody thinks that's true, but nobody has a problem paying taxes for education and believing that education is at the very least a human right.
Right. I mean, say you're single and you don't have kids, you're still paying taxes for kids to go to school,
but
not your kids.
Here's another thing is if I broke my leg right now on the spot, I could go into the emergency room and get covered no matter what.
Yeah.
They can't turn me away because my pockets are empty.
Yeah, they absolutely have to, So, help you.
I mean, isn't this right to health you're speaking of outside of insurance still there?
It's there, but I think, it is there because you're right. If you go into the ER, they must help you no matter what. Even if you're an illegal immigrant, they have to help you.
And a lot of illegal immigrants just use that as their healthcare in the first place. Or actually, they probably have to.
Well, yeah. But then you get slammed with, a $5,000 ambulance surcharge that had to take you down the street. You know what I mean? And you didn't choose to break your leg. Right.
There was an interesting little moment in the debate where Sanders, I thought, made a good argument and then argued against himself all in the same sentence.
Please.
And it was like, it was very strange, and I'm not sure what to make of it. But basically Cruz said we have the right to access to healthcare, and then Bernie said access means nothing if you can't afford it. Like that makes sense.
I like that.
That makes sense. He said people have access but will never get healthcare because they can't afford it. Is that their right? And then I would say somewhere along the lines of they can go to the emergency room, and if it was cheaper, it'd be fine. You're the reason it's so expensive. But he compares it then to Donald Trump's mansions, and he says we all have access to purchasing these mansions, but that means nothing. I'm like, in my mind, I'm thinking now, you don't have a right to those mansions. Yeah, you have access to them. You can't afford them.
Right.
You do not have the right to grab one now. Like,
for free.
He, for some reason, decided that like twisted the argument in a way. I'm like, yes,
like you should have
Bernie,
stopped at the first part of the sentence.
You're right. I don't have a right to Donald Trump's mansions. I cannot afford them.
I would. I mean, I don't know, but I would chalk it up to poor word. I think he would mean like, say you're looking in the Realty magazine, you see a mansion for sale. You say, I have access. I have the right, and I'm able to buy this mansion. I have the access to buy this mansion.
But in his scenario, he's saying the government should now provide this. He's comparing healthcare to a mansion that I cannot afford, and now saying the government must provide it. I'm just saying he tripped up.
No, you're right. He did trip up. You're right.
The man tripped up. He kind of contradicted himself.
Yeah. I mean, talking about, you brought up Trump. I just wanted to talk about his stance on ACA and Obamacare. So it's quite clear. There's trends. We'll actually throw the trends up. The uninsured rate went from 41.3 million to 28 million people. It's obviously a net gain, net benefit. There's no argument there. And what was it? I think 75% of people either don't want ACA to be repealed, or they want to at least see a replacement on the floor before it's repealed. Do you think
Fair.
it's what's the word I'm looking for?
Possible?
No, not possible. Do you think it's not unjust? This sucks. I hate when I do this.
Unjust?
No.
Wrong?
I guess wrong for now. Maybe we can replace it later.
Yeah, I need to know what else you're saying.
Do you think it's wrong to just repeal it without any kind of replacement in mind? Like right now, they're banking on the insurance companies to compete again for lower prices. That's it. That's the only idea they have right now.
Mm-hmm.
Do you think we need to at least wait for a replacement?
Well, here's the thing. I am not an economist, and I would like to see the potential. I mean, what Cruz talked about was not just repealing it and leaving nothing, but having what he called common sense reform, where now you can buy insurance across state lines, and the insurance does become portable, and the competition explodes to the point where each person can get the exact insurance that they need.
So now that was something that you couldn't do before Obamacare, right? You couldn't purchase across state lines?
No, I don't think you can now.
Oh, but you could before.
I don't think you could ever.
You could. Okay, so he's basically saying
this is just a general reform.
There are ideas that could. So you're saying like nationwide competition,
exactly,
not locally between 2 or 3
not
insurance
according
companies.
to his graph, 1 or 2 for 70% of the counties in America.
So I see California has an insurance policy where it'll cover the 2 colds a year I have. I'm gonna get that one because it's $100 a month.
Right. So instead of, as far as I can tell, instead of these insurance companies working with employers, and then when you leave the employer, whatever, you lose that insurance. Insurance companies are now working directly with, you, the citizen.
Gotcha.
And now that carries with you, whatever, because you're paying into that.
I mean, that sounds pretty good. But what about the people that still couldn't afford that? Like, do you agree with universal healthcare? Like, do you think it should be enacted here in this country? It is true that every other developed nation has it.
Not a blanket. What the argument against that is, every other nation that has it is nothing like us. They're way less people, way more homogenous, way less diversity. That's
a good point. Yeah,
the diversity in
we're huge.
in income alone is different. People's lifestyles are different. It's a whole different ball game.
I mean, how big is England? You know what I mean? Or
right, the UK. What I would say is the blanket quote unquote Lamborghini doesn't sound like a good idea, but essentially, if you could just, I would not be against socializing healthcare for the poorest of people. I don't know how you do.
Well, that's what Medicaid is, right?
Essentially.
Are you okay with expanding it, or that it was expanded?
What is I don't really know exactly how it expanded and what it expanded into. I don't know what they did to blow it up.
Basically, so they said if you live within a certain percentage of the poverty rate, you could get Medicaid, and they just made that percentage bigger.
Just match the poverty line.
Yeah. So anyone living in poverty gets Medicaid, basically.
I mean,
that's still taxpayer, though.
Yes, but that's not me paying for your health care. That's just allowing it. Bernie was talking about the poorest people in America and how everybody's so rich and they deserve the hate. Just draw it at the poverty line. Now, as a country, we're all pitching in for the people who need it most, and hopefully that will allow them to get up on their feet.
Well, hold on a second. I think I misspoke. I believe it's you qualify for. So here's there's a poverty line, right? Mm-hmm. If you're under the poverty line, you obviously get Medicaid. I think it's actually you qualify for Medicaid at like 138% of the poverty line. So if you're actually a little bit above it, you also qualify for Medicaid. I think that's the expansion that Obamacare made. It went up and above the poverty line to 138%.
So I guess the problem is that above that line, you're still struggling, obviously.
Right.
So health insurance isn't an option because even the cheapest would be way too expensive. Is that I'm assuming that's the problem, and we just tried to simplify it way too much.
I mean, there's still people who can't afford it. You know what I mean?
Right. Yeah.
And these people have sometimes it's not all individual. These people have families to take care of. Mm. And what if your child has a pre-existing condition that you had no power over? You know what I mean?
Yeah. No, it is a debate. I did look up Bernie's quote in 2015. There were 43.1 million people in poverty.
In poverty. Oh, and
that's exactly what he said. That was his quote, and that's exactly what the Census Bureau has on their report. So,
okay.
3.5 million less than the year before, and this was 2 years ago. So hopefully it's still going down.
The trend continues. Yeah.
Hopefully the trend continues. Dude, if we are covering the nation's poorest people as it is already, then the system is in place. If we can increase the competition, add these quote common sense reforms, then it should be something where you can have health insurance for an extra $15 like a month.
Right.
Like it shouldn't be
because to subsidize for these poorer people, basically.
What do you mean?
Like you said, for an extra $15, basically to support those extra people.
No. I'm saying for those people outside of that bracket, if you increase competition and they're not getting the subsidized health insurance, that drive the prices down enough to where you
don't
can't
need
afford
subsidies.
It. Right. As opposed to making everybody pay for the same exact type of insurance.
So it's a big problem because on the left side they're gunning for universal health care, and on the right side they don't want universal health care for a multitude of reasons. And I mean, I would assume any kind of bills would get passed now that we have that the conservative has the majority in Congress.
Well, I mean, because apparently it's also stopping it's stopping economic growth because these businesses don't want to hire employees for more than 29 hours a week because that's when it kicks in, and don't want to hire more than 49 employees.
That's true.
Because that's when it kicks in.
You're right. And if we had universal health care here, private insurance companies would be all but gone. That's a lot of people.
And to be fair, on that point, that was easily, I don't know what you think, where Sanders fell the hardest in the debate is when that lady, I forget, I think her name was like LaRonda.
Yeah.
She had like 48 employees, but her profit margins are so thin that if she hired two more and had to get insurance, she would start losing money.
She'd go bankrupt.
Essentially, like slowly, but she wouldn't be making a profit anymore. So what can she do to have her business grow without raising the prices to where less people would come in or lowering the wages of her employees?
Wow. So she was just at a standstill.
Right, and he literally, all he said was, you need to give them health insurance. What? He gave no alternative.
Oh, wow.
It was the low point in the debate. For him.
No,
so literally Cruz was smiling at that point.
Oh no.
I mean, he had to hide it obviously. This woman was in trouble. But I mean, that's the whole point is that he talks about these millionaires way up top that like we're attacking, but in reality, according to Obamacare, in his opinion, these are the people now that you're not attacking, but these are the people that you want to pay.
Yeah. I mean, the other side of the argument is people who had $200,000 in debt from cancer and now don't have to, you know what I mean?
Right.
There's always two sides.
I don't think I can go further personally than subsidizing those below the poverty line and maybe a little bit above it.
Yeah.
And I don't even know about the old people, man.
Well, they're retired. I mean, there's no really income. Social Security may not be there by the time we're 65.
Yeah, that's a whole other debate, though.
It is. You're right.
Shall we move on to the final debate?
I think so.